Hi everyone, this is Dr. Ganesh, Consultant Interventional Cardiologist, TTK's Heart Clinic, Kodambakam, Chennai. So on the occasion of World Heart Day, today I am here to discuss about basics of a heart attack. So what are the causes of heart attack? What is the mechanism by which an heart attack occurs? What are the symptoms and how to prevent it? So as you all know, heart is a very important organ and all other organs depend on the heart's function for receiving blood supply. So only when the heart pumps normally, all the other vital organs, for example, the heart, the brain, kidneys, digestive system, and all other organs will get enough blood supply. So for the heart to function normally, it also needs adequate blood supply, like any other organ. The heart is supplied by 3 blood vessels which run on its surface. They are called coronary arteries. So these coronary arteries are very important for heart's blood supply. So what happens in an heart attack? These coronary arteries are diseased, leading on to heart attack. So what are the risk factors or what comorbid conditions can lead on to heart attack? Commonly in our country, diabetes mellitus, hypertension, high cholesterol, smoking, excess alcohol consumption, and also stress is a major risk factor for heart attack. So how do these risk factors cause heart attack? So these risk factors generally lead to an increase in the cholesterol levels in the body, which in turn gets deposited on the inner aspect of the blood vessels, especially the coronary arteries. So when cholesterol gets deposited, these starts forming blocks on the vessels. So these blocks actually contain cholesterol. So when the cholesterol level goes on increasing, the blocks tend to increase in their size. So when the blocks increase, they tend to encroach on the lumen of the blood vessels. So when this lumen is going to get compromised, the blood flow distal to that block is going to get reduced. So when these blocks tend to increase over a period of time, for example, initially from 20, 30%, 40%, when it goes up to 70%, it causes significant interruption in the heart's blood supply. So when it goes beyond 70%, there's always a risk of these blocks getting ruptured. So when the block ruptures, it activates platelets and forms a clot. So this clot completely occludes the blood vessel, causing a 100% block. So this is what actually happens in a heart attack. So what symptoms do you get when a heart attack occurs? Typically, the symptoms will be chest pain, which is mostly central chest pain and left-sided chest pain. Sometimes the chest pain can go to the left arm and forearm. Chest pain also can go up to the neck or sometimes up to the abdomen and even to the back. Other symptoms apart from chest pain will be breathlessness, sweating, nausea, vomiting, etc. And if in case the patient is uncontrolled diabetic, you need not get all these typical symptoms. Instead, atypical symptoms like chest uneasiness, a feeling of heaviness in the chest, giddiness, etc. can be the only symptoms. So that is a risk of having diabetes. You don't get the typical symptoms of a heart attack. If you get any of the above said symptoms, it is a situation where you have to immediately rush to the hospital and get an ECG done. So what are the methods to prevent or avoid getting a heart attack? So risk factor prevention and lifestyle modification are a very important methods to avoid getting a heart attack. So starting from diet and lifestyle modification. So what changes in your diet should be done? So heart healthy diet, which contains more vegetables, fruits, nuts, grains, etc. should be included in your diet. At the same time, diet which is rich in saturated fat and trans fat needs to be reduced. For example, coconut oil, palm oil, cheese, butter, sweetened beverages, and common junk foods like bakery products, cakes, pastries, cookies, ice creams, etc. should be avoided. Instead, food which is rich in unsaturated fat, that is polyunsaturated fat and monounsaturated fat should be increased in your food. For example, oils like olive oil, groundnut oil, sunflower oil, etc. Nuts like almonds, walnuts have to be increased in your food item. Also, non-vegetarian food items, example, fishes which contain more omega-3 fatty acids can also be included in the diet. And salt is a very important risk factor for heart disease. So reducing the salt content by 25% itself will reduce the risk of getting hypertension and heart disease. If you are a cardiac patient already, reducing the salt content to less than 50%, that is 1.5 grams per day, will help in preventing complications from heart diseases. Moving on to exercise. So we should always aim at least 4 to 5 days in a week of moderate intensity exercise for at least 45 minutes to 1 hour. So accumulated exercise in a week should be at least 150 minutes in the entire week. So what sort of exercises can you do? You can do simple exercises like brisk walking, jogging, cycling, yoga, etc. If you have a fitness tracker, always aim for 8,000 to 10,000 steps in a day. And particularly if you are working from home, make sure that you get up from your sitting position, walk for at least 5 to 10 minutes, and then you can resume your work. Next is prevention of drinking. Sorry, can you just cut at this point and then again record? So I'll start again. So next is avoiding risk factors like smoking and alcohol consumption. So smoking is a very important risk factor for heart disease. So smoking can cause hypertension, dyslipidemia, and heart attacks. So if you stop smoking, the risk of getting heart attack goes down by 50% in just 1 year of time, and almost by 100% in another 5 years time. So smoking cessation is a very important method to prevent heart diseases. At the same time, alcohol consumption also has to be reduced. Other important risk factor is stress. So nowadays, a lot of patients in the younger age group, for example, less than 30 years or 40 years, the most important risk factor or the only risk factor is stress. So stress needs to be avoided. What are the methods to reduce stress? Doing regular exercise, doing yoga, interacting more with your family members, getting a good sleep will reduce your stress levels. So if all these above said methods can be followed, heart attacks can be prevented. So our heart, it is our responsibility that we take adequate precautions to prevent heart diseases. Thank you.